Good afternoon. Myself, Dr. Aarti Gupta Tulli. I am working as a senior consultant in the Department of Obstetrics and Gynecology at Fortis Hospital, Mall Road. I am here to clarify the very common public problems which are related to pregnancy and other problems which are related to ladies. So, newlywed couple, they usually approach me in the OPD and they'll ask me a very important question. Ma'am, when I should plan pregnancy, what should I do before I plan pregnancy? So this is called as preconceptional counseling, that before conceiving, you want a counseling. And I think this is the best thing the future or the coming generation they are doing. They are already careful. So as an obstetrician, I will check your journal blood test, see how much hemoglobin is there, or you are suffering from anemia, or you are suffering from any other disease like thyroid, sugar. I'll check your weight. Is it in the appropriate range that you should become pregnant? I'll check your blood pressure, whether it is the normal. And then, very important, your family history. If there is anything problematic in your family, we'll already do the needful for that. And then very important in this aspect is your vaccine history. So sometimes there are different infections which infest during pregnancy and they should not. They are not good for the baby. So there are different like MMR vaccine. Government also started that routine thing like they were vaccinating in school. So MMR vaccine, hepatitis vaccine, chickenpox vaccine, influenza vaccine. So we'll just take a small history of your vaccination, and if you are not already vaccinated, then we'll advise, and if you get yourself vaccinated, we'll advise you not to get pregnant in another 1 month for the effect of the vaccine to go. Otherwise, it's thoroughly good. We can start you with the supplements like folic acid, which is a miracle vitamin for a pregnant lady and prevents the baby and the mother as well from many problems. So all the best, whoever is coming for preconception counseling, have a healthy pregnancy. So the most common question which I encounter is, what should I do when I think I'm pregnant? There are two lines. So first of all, congratulate yourself. Enjoy this. This is a new beginning of your journey. Don't panic. As soon as you know, you should contact the gynecologist. Not only to know how the things are going to be, it's for the well-being of the baby. See, this pregnancy is healthy or not. It all depends on your test, your ultrasound report, and your previous history also. And what are the addictions, like if you're smoking or you are drinking or you're on some drugs. So all these things in total, when we take in this the family history, your past history, your obstetric history, and taking into account your tests, we can confirm that this pregnancy is a healthy pregnancy or not. People are really worried about these days that how much weight should I gain or how much weight should I not gain. See, this weight gain will depend on your pre-pregnancy weight. So we calculate the basal metabolic index. It is from individual to individual. So if you are underweight, less than 18.5 is your BMI, then we recommend a weight gain total of 12 kg to 18 kg in whole 9 months. And if you are obese, like your BMI is more than 30, then we recommend a lesser weight gain, that is around 5 to 9 kg. And if you fall in healthy, like between 24.9 to 30, then also it is around 11 to 16 kgs of weight, which is recommended. Along with that, we always consult a dietitian. We keep a loop. A good obstetrician will always keep a dietitian and a physiotherapist in a loop. Now, the people are worried and they ask the question that what should I do if there are cramps or bleeding during pregnancy. See, this is something serious if it is bleeding. If it's only crampy pain like you have during periods, then also you need to go and approach your obstetrician. Maybe she will order an ultrasonography, maybe she will examine, and if it is bleeding, naturally we need to see the patient as a whole. Maybe we'll recommend a per vaginum examination. Maybe there is a small polyp, there is a small erosion, or maybe in ultrasound it shows that the pregnancy is not healthy, or the placenta is lowered down, or there is a subchorionic hemorrhage. So these things, if there is any problem, I must say, you should not carry on at home, but you should immediately contact your doctor and do what is needed. And very, very common, the people, they will ask me whether they can have sex during pregnancy. Say, if we see, it's a normal physiological process. So it is not that ladies cannot have sex during pregnancy, but in my opinion, what I say, if they want to have sexual relationship during pregnancy, they should always use condom. Because when the sperms is ejaculated, they contain something called prostaglandins, and they sometimes can stimulate the uterus. And in first 3 months, I will say already the female is puking, she's vomiting, she's fatigued, she's nauseating. She may not feel like also that she wants to have a sexual relationship, but it's very personal. But rest assured, it is not going to cause abortion. It is not going to cause a preterm labor. It depends on like how you are taking it and how you are discussing it with the gynecologist. If you have medical issues, you have medical problems, it's absolutely no. And if it's an uncomplicated pregnancy, in discussion with the obstetrician, it is always safe to have sexual relationships. Another, I will say, common question is, should I go to bed rest? I should not climb the stairs. I should not do any household work. It's absolutely no. You should not take rest. You can climb stairs. You can do household work. It is like you are not diseased. If you have become pregnant, it doesn't mean you have got a disease in you. It is a time to celebrate, to enjoy. And exercise is also as much required as when you were not pregnant at that time. And these exercises, believe me, is not only to help in your overall well-being, but it is also going to help you counter the labor and then the delivery. And always people want normal delivery. So this is going to help you. But all these exercises in consultation with the obstetrician and physiotherapist. I will not recommend any exercise which involves the contact like football, hockey, cricket, where there may be chances of injury, there may be chances of fall. But light exercises, yoga, swimming, and at home pilates, and taking care of the belly, that you can do at home. And walk, believe me, is the best exercise you can do during pregnancy. It's uncomplicated pregnancy. Go ahead with the routine exercises. During pregnancy, what food can help? What food will be dangerous? So you should eat all the things which are cooked at home. Nothing is stopped. From my side, I don't stop any of my patient to eat anything. But yes, it is individual approach. If you are not able to digest anything before pregnancy, you will not be able to digest now also. And for me, I say no to all the junk food and no to all the food which are available in the market. And if you have any problem, any fever, sore throat, diarrhea, I don't have any antibiotic to give to you. Related to pregnancy also, people ask me, what is ectopic pregnancy? See, a normal pregnancy, that is in the uterus in layman language, but an ectopic pregnancy is in the fallopian tube, and it's not a normal area for pregnancy to grow. An ectopic pregnancy, mind it is an emergency condition. The moment ultrasonologists tell you that this is ectopic pregnancy, you have to rush to your doctor and show the report. Then she will decide whether this ectopic pregnancy needs to be treated with a medical management like with drugs, or it needed surgery to be performed for this, because in many cases it ruptured and the tube has to be removed at that time. While we were discussing about pregnancy, there is one thing which is called intrauterine growth restriction. And sometimes at around 28 weeks, 30 weeks, 32 weeks, suddenly everything was going rosy and everything was going well. And suddenly you went for an ultrasonography and they tell you, it is intrauterine growth retardation. So it is now to find out why you have intrauterine growth restriction or retardation. So your doctor is best to guide it. We need to undergo few tests and has to be seen whether it is mild, moderate, severe. So it is like the ball is in the hand of the doctor, and she is going to decide how the outcome of this pregnancy will go on. Uncommon entity people talk about is placental abruption. So placenta, if you know, it's the part which is a connecting link between the mother and the baby. If anything goes wrong with the placenta, the baby is going to suffer. So you can see the term placental abruption. So something is going wrong with the placenta, and that is why the baby is at risk. So what happens? The placenta is at a proper place attached in the uterus, but because of any condition, because of your accident, there is a fall, or you have high blood pressure, or anything like hypothyroidism, then this placenta starts separating prematurely, not at the time of delivery, and suddenly you were sleeping and you will see that your tummy is very hard, and suddenly you may feel that your baby is not moving. So it is a grave emergency. You may lose your baby. So that is why counting the fetal movements and seeing the status of the tummy, if it is relaxing in between, if it is not relaxing in between, it is very important. And the crux is contact your doctor. A very common problem which is seen in pregnancy because of the physiology of pregnancy and because of the anatomical changes during pregnancy is urinary tract infection. Every fourth, fifth person who comes to show me during pregnancy has urinary tract infection, but mind it, we need to treat it. We have few antibiotics to treat urinary tract infection, but it can affect your pregnancy. It may lead to abortion, it may lead to preterm birth and early delivery. So that is not good for the baby. So anytime besides urinary tract infection, any other infection, any other cause of fever or any other discharge, you must contact your doctor, because otherwise it may lead to premature delivery of the baby. A very common infection which is seen in all the females, irrespective of age group, urinary tract infection. Most commonly seen in the reproductive age group and more so in the postmenopausal age group also. So if you see the anatomy, why you hardly see any man complaining of urinary tract infection? Because the size of the urethra of a female is only 4 centimeter, and it is very close to the vagina, where every month you are going to bleed, and it is very close to the anal area where daily you are defecating. So while cleaning only or a poor hygiene, and crossing the germs or the bacteria 4 centimeter is very less distance. So that is the reason why females usually have more symptoms of urinary tract infection as compared to men. And the other thing is that during menopause, this area, the lower part of a female, that gets atrophied. The blood supply decreases. So naturally, the resistance of the urethra to combat this infection, that also decreases. So what are the symptoms? They will say that either it is burning during passing urine, or it is painful while they pass urine, or the frequency again and again they are running to washroom, or they are not able to pass it properly. It is coming in the form of droplets. So these are the various symptoms. Sometimes it is a pain abdomen. It's a great agony for a female. But believe me, there are very good medications for this. So don't worry. Always approach a doctor. And a very common question I encounter in my OPD. Ma'am, I have a Rasoli. I have a fibroid uterus, and they are terrified. They will come in a fearful condition that now they are going to have cancer. Madam is declaring Rasoli is a cancer. So rest assured, fibroid is hardly cancerous. It is a non-cancerous tumor, very common tumor of the uterus, but it is non-cancerous. With due respect to our all elders who always complain to me, Madam, in our times, normal delivery was the thing, and now we hardly see any normal delivery. So, partially, I will say definitely normal delivery is decreasing because of lesser physical activities and diet, which is more modernized. But if we take in another sense, that a female is studying for hours to whatever she wants to achieve, so she needs to sit also. So don't blame it. Don't play a blame game that where she has become pregnant and she is taking rest only, and she's not working properly for normal delivery. I'll say that it is all the physiology. With time, the things are changing. Before 10 years, it was something else. Before 20 years, it was something else. So adapt that also, that in next 20 years, it may be something else. Now also, normal deliveries are happening with the motivation of the parents. They don't demotivate, and with the motivation of the doctors. Naturally, I discuss about exercises during pregnancy. They definitely help. Just motivate. You do your best. I hope this information was useful and very good for all the viewers of Health Plus. Thank you so much.